15th, 1914 in Baltimore, Maryland. Orem was raised in a Catholic family, and her upbringing in Baltimore provided a foundation of strong family values and a deep sense of responsibility to others. Her father worked as a construction worker, her mother as a homemaker, and she was the youngest of the two daughters. Dorothea's background was not wealthy, and her parents emphasized the importance of education and hard work. She had a strong interest in healthcare and a desire to help others, which led her to pursue the career in nursing. Orem's decision to become a nurse was influenced by a combination of her own interest in caring for others. For high school, Orem attended Seton High School in Baltimore and graduated in 1931. For her Bachelor of Science of Nursing, she attended Catholic University of America to earn a Bachelor of Science in Nursing Education in 1939. For her diploma, she attended Providence Hospital School of Nursing in Washington, D.C., and graduated in 1943. For her Master's of Science of Nursing, she attended Catholic University of America in Nursing Education and graduated in 1945. As a young woman, she likely saw the nursing as a noble and practical profession that allowed her to serve others in meaningful ways. Her early exposure to nursing practice gave her insight into the practicalities of patient care and the challenges faced by nurses in delivering high-quality care. This experience provided preparation for her later work in developing nursing theories and models. Worked in various roles, including as a staff nurse, serving as a director of Providence Hospital School of Nursing in Detroit, Michigan, from 1945 to 1948. She also taught biological science and nursing from 1939 to 1941. At the Catholic University of America, Orem served as assistant professor from 1959 to 1964, as an associate professor from 1964 to 1970, and the dean of the School of Nursing from 1965 to 1966. She spent time working at hospitals and other healthcare settings where she gained firsthand experience with patient care and the challenges that nurses face in promoting health and addressing illnesses. Dorothy Orem received numerous awards and honors throughout her career in recognition of her groundbreaking contribution to nursing theory and practice. Her work, especially the self-care deficit nursing theory, had a huge impact on the nursing profession and nursing education globally. Some of the key awards and honors she received include honorary doctorates of science from both Georgetown University in 1976 and Incarnate Word College in 1980. She received an honorary doctorate of humane letters from Illinois Wesleyan University in 1988 and a doctorate honors causa from University of Missouri in Columbia in 1988. Some other awards she received was the Catholic University of America Alumni Achievement Award for Nursing Theory in 1980, the Linda Richards Award from the National League for Nursing in 1991, and the Honorary Fellow of American Academy of Nursing in 1992. Orem passed away on June 22, 2007, at the age of 92. She spent her last 25 years working as a consultant and an author. Her death marked the loss of one of nursing's most influential theorists, whose work shaped the ways of nurses approach patient care, especially in relation to the concept of self-care.
During the development of Orem's self-care deficit theory in the 1950s and 1960s, American society was experiencing significant social and healthcare changes. World War II had recently ended, leading to advances in medical technology and increasing numbers of women entering the workforce, including nursing. The role of nurses was evolving from purely task-oriented care to a more professional and theoretical approach. Healthcare was becoming more accessible through programs like Medicare and Medicaid, while the women's rights movement was gaining momentum. During this period, nursing was striving to establish itself as a distinct profession separate from medicine, and Orem's work contributed significantly to this goal by providing a theoretical framework specific to nursing practice. The prevalent health challenges of the time, including chronic diseases and rehabilitation needs of veterans, influenced Orem's focus of self-care and patient independence. Orem's theory was fundamentally influenced by the systems theory, particularly which viewed organisms as complex systems with interrelated parts. She also drew from humanistic psychology, which emphasized individual potential and self-actualization, and from biological science's understanding of human functioning and adaptation. Notably, Orem's work reflected the influence of Talcott Parsons' social systems theory, particularly in how she conceptualized the relationship between healthcare providers and patients as a social system with defined roles and responsibilities. These philosophical and disciplinary influences directly shaped her theory's core concepts. She applied systems thinking to view self-care as an interconnected process, used biological sciences to understand human functioning and needs, and incorporated social theory to define nursing role in supporting patient self-care. The combination of these influences led her to develop a theory that emphasized the patient's capacity for self-care while recognizing the nurse's role in supporting and developing in the capacity where the deficits occur.
Raphael Orem's theory of nursing system is a grand nursing theory that addresses the critical role of self-care in maintaining health and the role of nursing in supporting those who are unable to meet their own self-care needs. This theory is based on the premise that individuals has an innate capacity for self-care, which is essential for health maintenance and recovery. It focuses on concepts such as self-care, therapeutic demand, and self-care agency. Self-care refers to the action people take on their own to maintain health, life, and well-being, such as managing diet, exercise, and personal hygiene. Orem introduces the concept of self-care agency. She refers to it as a person's ability to perform self-care activity independently. This capacity can vary depending on factors such as age, health status, or environmental conditions. When an individual cannot perform self-care, they experience Orem's self-care deficit. Nursing intervention then becomes necessary, guided by one of her nursing systems. She described them as wholly compensatory, partial compensatory, or supportive, educative, and I will further explain that later on. The theory emphasized that nursing care should help patients improve their self-care ability and prevent self-care deficits. Nurses can help patients with self-care by providing reminders, motivations, recommending easy-to-use clothing, creating a good environment for eating, healthy diet, working with other specialists to make sure that things are done correctly. Ultimately, the theory underscores the goal of nursing is empowering patients to achieve or maintain their health independently whenever is possible. Her theory also contributes to education. Her self-deficit theory has been the focus of the curriculum in nursing education and many schools of nursing. She also contributed to research. The self-care theory provides conceptual framework for many researchers. In practice, her theory guides the nursing practices, defining when nursing interventions are necessary and differentiating from medical care as well. Orem's nursing theory consists of three theories: theory of self-care, theory of self-deficit, theories of nursing system. The theory of self-care consists of self-care, self-care agency, therapeutic self-care demand, Self-care requisites. Self-care are activity initiated and performed by individual to maintain life, health, and well-being. Self-care agency is the ability to engage in self-care influenced by factors such as age, life experience, social orientation, health, and individual resources. The self-care agency consists of two agents, self-care agent and dependent care agent. The self-care agent is a person who provides self-care independently. Dependent care agent is the person other than the individual who provides the care, such as a parent, a friend, a nurse, or a caregiver. Self-care requisites are actions directly towards self-care. Self-care requisites states the reasons for which self-care is done. Those express the intent or desired results. There are three categories in self-care requisites. They are universal, developmental, health deviations. Universal self-care requisites associate with life processes and the maintenance of the integrity of human structure and functionings. Those needs are common to all. They are more like activity of daily livings, such as air, water, food, elimination, rest, activity. The universal self-care requisites also include a balance between activity and rest, social interaction, environment, prevention of hazards to human life, and promoting human functionings. Developmental self-care requisite associated with developmental processes, and they are from a condition or associated with the event. For example, adjusting to a new job, adjusting to body image. Health deviation self-care required in condition of illnesses, injury, and diseases. For example, using a crutches after a leg fracture. Example for healthcare deviation self-care are seeking medical assistance. Beware of the side effect of the conditions. How to use appropriate measures. Modify self-concepts to accept oneself. Learn to live with the effect of the diseases. Theory of self-care deficit is the central focus of Orem's general theory of nursing. It describes how people can be helped through nursing. In the theory of self-care deficit, it's specified when nursing care is needed, particularly when an individual cannot meet their self-care needs. A nurse can help a patient by acting or doing for others, direct them to the right places, providing physical or emotional support, providing a safe environment. Also teach them how to take care of themselves. The theory of nursing a system describes how the patient's self-care needed will be met by the nurses, the patient, or both. In the theory of nursing system, there are three classifications to meet the self-care requisite of the patient. They are wholly compensatory system, partially compensatory system, supportive educative system. In the wholly compensatory system, the nurses should be compensating for a patient's total inability for engaging in self-care activity that required assistance. For example, ambulations, manipulation of movement. In other words, the nurses accomplishing patients' therapeutic self-care since the patient's actions are limited. Supporting their needs are also very important. In the partly compensatory system, it requires the nurse and the patient to work together for the limited care the patient can provide for themselves. In the supportive educative system, where the patient is able to perform required measures of external or internal oriented therapeutic self-care, but cannot do so without assistance. In other words, in this system, the nurses need to regulate what the patient is doing, providing education materials so they can learn and to take care of themselves. The self-care deficit theory has major assumptions. Number one, humans are unique individuals that are separate from each other and from the environment. Two, all people wish to care for themselves. Three, people are capable and willing to engage in self-care and care for dependent members of the family. 4. Self-care and dependent care are learned behaviors through communication and interaction with each other within a social cultural context. 5. Nursing is a deliberate helping action performed by nurses for the benefit of others over a certain period of time. 6. Humans are supposed to be self-radiant and responsible for their self-care needs and care needs for dependent members. The model shows that when an individual's self-care capacity are less than the therapeutic self-care demand, the nurses compensate for the self-care or dependent care deficit. Self-care deficit theory of nursing focus on the idea that nursing is required when an individual is unable to meet their own self-care needs. This theory adjusts the four major paradigm concept of nursing: person, health, environment, and nursing. Nursing is defined as the art and science of assisting individuals to meet their care needs when they are unable to do so on their own. Orem's depiction on nursing is the action taken by the nurse to help individual maintain or regain the ability to meet their own self-care needs. She believed that nurses has the application to assess self-care deficit, plan interventions to address those deficits, and also it is a nurse's duty to provide support to the patient. She sees nursing as a therapeutic relationship that promotes patients' independence, health, and well-being. Health is defined as the totality of being in balance, healthy structure and function. Life is not the absence of disease, but a position where people are partially or completely capable of attending to personal needs for well-being. Orem's depiction on health is that health is achieved when the person is able to engage in self-care activity to maintain their well-being, such as physically, psychologically, and socially. A patient or person defined as an independent, self-governing individual in terms of self-management. In this scenario, the patient will be defined as an individual who is in need of care. She sees it, a person is holistic. We must treat it as a whole person. That includes physical, emotional, and developmental aspect of the person. Orem considered the person as an active participant in their care, with nursing supporting them to perform self-care and achieve self-care agency. The environment refers to both internal and external factor that affects an individual ability to provide self-care. Those elements can be social, cultural, or physically that hampers an individual's ability to manage one's health. Orem also knows that self-care can be supported by other people, such as family, community, or a healthcare system as a whole, to promote independence. By incorporating the meta paradigm, Orem highlights the importance of the nursing role in promoting self-care and helping individuals to overcome the self-care deficit. Orem has provided clear definition of the four meta paradigm in correlation with the assumption of the person, environment, and the nursing in the theory of self-care. Orem was able to define the paradigm of nursing to portray nurses as the backbone of healthcare, where patient forms the central part of the healthcare.
In addition to the meta paradigm concept, Orem also had a self-care deficit nursing theory. They were also broke down into several core concepts: self-care, self-care requisites, self-care deficit, and nursing systems. Self-care refers to the activities individuals perform on their own behalf to maintain health and well-being, like bathing, eating, exercise. In relation to others, self-care is the starting point for understanding the need for nursing intervention. If an individual performs self-care effectively, they do not need requiring the nursing assistance. However, if there's a deficit, their nursing intervention is needed. Self-care requisites, also known as self-care needs, are the essential needs that an individual must meet to maintain health and well-being. In relation to others, these needs arise from individual experience of illness or injury. Self-care deficit occurs when an individual is unable to perform self-care activities due to illness, injury, or other limitations. In relation to others, the self-care deficit arises from individuals cannot meet their self-care requisites, creating a need for nursing interventions through the nursing system. Nursing system describes the role of the nurse in supporting or compensating other self-care deficits. There are three types of nursing systems. Wholly compensatory system. The nurse does all of the care for the individual. partially compensatory system. The nurse assists the individual with self-care activities. Support educative system. The nurse educates and supports an individual to perform self-care activities independently. How it relates to others, the nursing system is the intervention that bridges the gap between the individual's self-care needs and their ability to meet those needs. In past years, numerous colleges and schools of nursing based their curriculum on the self-care deficit nursing theory. Hospitals in several areas in the country have also used her theory, and they've been applied to an ambulatory care setting. The article that I found was The Effects of Self-Care Education Based on Orem's Nursing Theory on Quality of Life and Self-Efficacy in Patients with Hypertension. The findings of the study showed that using Orem's self-care theory as an educational platform has helped patients with hypertension go to their follow-ups and just improve their quality of care, engage in activities, and just, engage more in their health and improving their health. A patient case scenario that I formulated was Mr. Castro, 50-year-old man, recently diagnosed with hypertension. He's coming to the clinic for his 1-month follow-up appointment since being told he needs to change his lifestyle or he'll be placed on medication for the management of his hypertension. So he's having difficulty making these lifestyle changes, as a lot of people do. This is a big life change, and it doesn't just happen overnight. So based off the self-care deficit theory, he's unable to change his diet, exercise, and maintain stress. Also, he's having difficulty checking his blood pressures at home. One way nursing clinical interventions can help him try to, get rid of these self-care theories, as we can provide him with the blood pressure cuff and teach him how to use it. Maybe he's at home and he doesn't know how to use it. He has a broken one. He doesn't want to speak up about it. We can also refer him to a dietitian. Sometimes people really just don't know what to eat. As many times as they're told, sometimes they need things written down for them, clear cut, or even recipes would be helpful. And we can encourage Mr. Castro to engage in low impact exercises, and we can start with walking. I think walking is a great way to help cardiovascular health, and its solo impact doesn't affect the knees too much, and I think that's just a good start for him. And then we can transition him maybe into finding something else that he enjoys. Many nursing research studies have used Orem's theory as a conceptual framework or as a source of testable hypothesis. Furthermore, over the years, many research studies have tested elements of the theory. An example that I wanted to present was the impacts of diabetes. Type 2 diabetes, we know, is a very large issue in our healthcare system. The purpose of this specific study was to investigate the effects of diabetes education on the self-care deficit nursing theory in patients with high A1C levels. The study is double-blind, randomized, controlled intervention study with a block randomized method. 70 patients were assigned to the intervention group and 69 patients to the control group. The findings showed that the self-management education based on the self-care deficit nursing theory showed that the effects of glycemic control on individuals with diabetes were improved. The self-care nursing deficit theory was a guide in helping patients self-manage, and it showed that self-care agency increased. It wasn't that significant, but it did show that behaviors improved, A1C levels decreased, and it just gave a better perspective for nurses in their practice. Nursing decisions have been guided by self-care agency of the patients, and how to help them were determined by the nursing systems. Overall, I think this is a good article because it shows that the theory works, and it does help nurses see, where patients need more help in terms of their care management. McEwen and Will state that Orem's theory is complex, as it consists of 3 nested theories within the theory itself. The 3 nested theories include the theory of nursing systems, the theory of self-care deficit, and the theory of self-care. McEwen and Willis define a nursing system as a relationship between the nurse and the client, and they define self-care as an action to ensure continued
continued life growth and development. The study identified here is preventing and managing diabetic foot ulcers, application of Orem's self-care model from the International Journal of Diabetes in Developing Countries. The study's purpose was to investigate the application of Orem's self-care deficit theory on prevention and management of diabetic foot ulcers in diabetic patients. The study method utilized was a quasi-experimental study consisting of an intervention group and a control group. The intervention group received interventions including 12 weeks of home care and 2 self-care training sessions. The control group received routine care only. The sample size started out with 60 patients with diabetic foot ulcers who were admitted to an endocrinology specializing hospital. 10 were excluded due to amputation and a lack of willingness to participate in the study. Measurement tools utilized included St. Alien Wound Score System, which was a measure of the severity of a wound from 1 to 3. And the needs assessment was based on Orem's model and consisted of 40 questions geared at identifying what actions the patients were taking to promote self-care. The results of the study showed that training for self-care management of diabetic patients enhanced their knowledge, their ability to control their dietary habits, and glucose control monitoring. The study noted a significant improvement of self-care scores in the intervention group compared to the control group. The study also revealed a difference in that the intervention group had a decrease in diabetic foot infections compared to the control group. Also noted was a large difference in ischemia, edema, neuropathy, and wound healing. I'd like to discuss the middle range theory of self-care of chronic illness, which built upon Orem's self-care deficit theory. This middle range theory specifically focuses on the self-care needs and behaviors of patients with chronic illnesses, expanding on Orem's broader self-care concepts. The theory identifies 3 key processes: self-care maintenance, self-care monitoring, and self-care management, which directly relates to Orem's concepts of self-care agency and therapeutic self-care demand. Like Orem's grand theory, it emphasizes the importance of patient engagement in their own care, but narrows the focus to chronic illness and management.